one of the things that I ran into that was a back bowling pin was I really felt like I just wasn't delegating enough.
Mm-hmm.
I was like, if I can just get, a house manager or a nanny in the house, that would help, because it would take things off my plate. But I wasn't realizing that if I have to heavily manage that nanny, or if that nanny kind of came with a bag of, things that I had to manage in addition, that I may actually be exacerbating other issues. Or if I traveled a little less, well, then that would help, but not if there's stress within the home. It's amazing because you're right that there is sort of a symbiosis. Everything's tied together. Yeah. So can you tell me a little bit more about that? I know that wholeness and things being tied together is such a huge part of how you create plans for the people that you're with. Can you tell us a little bit more about your ideas around that?
For sure. So I frequently say, it doesn't matter if I'm talking about sprained ankle, diabetes, or depression. I always think in terms of these major buckets of what are the mind components, what are the biochemical components, what are the structural components. Okay. And that can get really fancy, but those are the buckets, right? Mm-hmm. But then I think what a lot of people don't think of is, we talk in medicine a lot about, and people hopefully have heard talk about social determinants of health, right? Hugely important from a community perspective, public health perspective. But I try to bring it into my office with every person. I call it the context of your life. What are your relationships? What are your financial situation? And it's not a number. It's more of a confidence than a number.
Ooh, that's good, y'all. And that is the truth. I mean, I have literally been anxious about money with millions in the bank, and I've been anxious about money with $24 in the bank.
Amen.
So you're right about financial confidence over actual financial situation. That is a word right there.
And then what is your physical environment? Because those are the things, your life, that have the opportunity to either be uplifting to your health or frankly oppressive to
value
your health.
Add or value drain.
Yeah.
So when I sit down and I come to you and present a problem or concern or whatever, what you're sharing with me is that instead of just being, sort of classic doctor experience that I think a lot of us have, where it's like, well, diet and exercise, what's your blood work say? Well, your blood pressure's high. What you'll say is, well, how's your home life? Or what are some example things that you ask?
Yeah, honestly, I usually start by saying what's new, and we don't realize this. We outsource way too much when it comes to our health, but every patient, every client of mine has an internal wisdom that if I let them talk, they will give me all the information that I need.
That is so good.
Yeah.